Welcome back to the Sunday Business Page.
There's a disparity in the medical care and survival of African American cancer patients and others battling the disease. The UPMC Hillman Cancer Center has addressed the issue through several programs over the last 10 years. Recently, it's collaborated with the National Cancer Institute and the University of North Carolina in a new effort to close that treatment gap. Here to talk about this are two guests. Dr. Lyn Robertson is Associate Director of Health Equity Education and Advocacy at the University of Pittsburgh School of Medicine and the UPMC Hillman Cancer Center. Dr. Dwight Heron is Director of Radiation Oncology at the UPMC Hillman Cancer Center. Hey, welcome to you, and thank you both for the great work you're doing in this important area. So doctors, let me start with you, Dwight, if I may. Yep. Is there a disparity among races as to who gets cancer?
Absolutely, there is a disparity. It's a long-standing disparity, and it really transcends lots of disease sites. We see it in prostate cancer, we see it in breast cancer, we see it in lung cancer, and sometimes it's related to access to health care. There is a communication or education gap sometimes that happens, and we see this across communities where individuals are worried about the word cancer, so they just ignore it, even when there are early warning signs.
I want to come back to that because that goes to treatment and prevention and the rest.
Absolutely.
But in terms of our bodies, are white folks more likely to get a certain kind of cancer than black folks or brown folks or, you know, anybody else? I mean, how does that work?
Absolutely, yes. I mean, it's clear that there are some genetic differences, and so some kinds of cancers we see, for instance, in prostate cancer, they may be more aggressive. There are leukemia, some blood cancers are less common, not to say that they don't happen in minority communities or African American communities, but they're less common than certain other kinds of cancers. And so a part of what we do is trying to educate those communities on what to look for.
I think that's so important because, frankly, until you folks, and looking at the readings in preparation, until you came on board, I wasn't that clear that there were certain kinds of cancer that might affect one race versus the other. So let me ask you about prevention and treatment, Lyn. What exactly, your study, is it called A Cure?
A Cure,
A Cure. So what are you learning about how we can best treat this, particularly in our African American community?
Well, what we did when we developed this study, first of all, we really engaged the African American or black community and also the white community, but we really wanted to hear their thoughts, what they felt were the positives and negatives. And then we did design the study, and as Dwight said earlier, we centered in on two cancers that we do see in the black population, being lung and breast cancer. And
lung and breast.
Breast.
And are they more prevalent in the black community than the white community?
Well, part of the issue is that generally treatment in the blacks are generally initiated later for whatever reason, many reasons of what Dwight alluded to, and they often have gaps in their treatment or they don't complete treatment. So that ends up meaning less of a good outcome and decreased survival. So we are very concerned about that at UPMC and in North Carolina, and so we wanted to put something in place that we thought would work.
And so one of the things that's also really important about this is that you know, there are certain diseases, certain other non-cancer diseases. So for instance, heart disease and say diabetes or kidney disease that may have an impact on the kinds of therapies that these patients, these communities, African American communities may actually get that may contribute to a difference in outcomes. So if they can't get the aggressive therapies because they have diabetes that's not well controlled or kidney disease that's not treated, that can have a disparity in outcomes.
Yeah, that makes perfect sense to me. And I also think that disparity with respect to treatment and access to treatment must be really important in this country.
Sure, absolutely.
What do you...
Well, it is, and I think that's one of the beauties and benefits of our large network, because we really try to have sites and centers many places. In addition to that, we are out in the community. We have navigators. Even within this study, we work very closely with the patients so that we developed a real-time registry, so we knew all the milestones of care for each individual person.
Right.
On a daily basis, got a printout of if they missed any milestone in their care, and we can intervene immediately. Like Dwight said, if access to care was an issue, they needed a cab, they needed someone to watch their children, they needed something,
right,
we intervened immediately so that we could help them to obtain the care as prescribed.
Doctors, are you both optimistic that we can tackle this, that we are tackling this? Do you need assistance from the government? Do you need help? I mean, what is it that we can do to really be helpful in dealing with this issue?
You know, I think this takes a village, right? I think it's multifactorial. It's many different elements. And that's what you see in the Cure. We actually are looking at not only the providers, we're looking at patients, we're looking at community resources, advocacy groups, and really even churches and barbershops.
Correct.
I mean,
Correct.
it's really a comprehensive view.
Right.
So you asked the question, am I optimistic? Absolutely. I mean, you do this because you believe that we're going to make a difference, that we can make a change in the burden of cancer. That's what we do every single day. And I think our community outreach and some of the programs that we're put together are really focused on really reducing the burden of cancer that we see in our communities, not just in Allegheny County,
Sure,
but frankly, you know, in the surrounding counties in Western Pennsylvania, now extending,
right,
you know, past Harrisburg and onward.
Well, I think what you're doing is great, and I want to thank you both for coming in and sharing with us. I think that you have to know the problem,
Yeah, absolutely,
in order to solve the problem.
This
right?
is very true.
And you're our knowers. So thank you so much again.
Thank
it's
you
great
so
to
much,
have you
Jon.
on
It's
the
a
Sunday
pleasure.
Business
Thank
Page.
you. Thanks
I hope
for
you
having
come
us.
back a year from now and tell us the success
Absolutely.
in the efforts that you're undertaking.
Great.
So thank you
Definitely.
again.
Thanks,
Thank
Jon.
you very
Thank
much.
you. When the Sunday Business Page continues, how the Ford Motor Company and its dealers continue their own war against breast cancer. Stick with us.